It's the old age question. Physios versus Chiros. Who's better for you? Watch and find out.
And is it bad to crack your back? For example, cracking your knuckles. I get a lot of patients asking me, like, is it bad for me to crack my knuckles or my neck and stuff like that? Alright, hey guys, today I'm here joined with my friend and colleague, Dr. Michael Liang. We both work together at Strength for Motion here in Richmond, BC. But basically today, we're going to be discussing the differences between physiotherapists and chiropractors. And hopefully by the end of this video, you're going to understand a little bit more about what each profession does and have a clear understanding of who you should be going to if you have a pain or an injury that you want to go see a profession, but you don't currently know who to go see. Well, I'll start with you, Mike. So what do you do? And tell us a little bit of what you've been up to.
All right, so nice to meet you guys. My name is Dr. Michael Liang. I'm a chiropractor here at Strength Through Motion. I went to school at the Canadian Memorial Chiropractic College. However, before that, I went to University of Windsor. I got my Bachelor's of Human Kinetics there, did my 4-year program, and then went to spend another 4 years at the Canadian Memorial Chiropractic College.
So that's what, 8 years in total?
Correct.
That's crazy, man.
Yeah. On top of that, we still need 3 board exams. Yeah, I mean, got through all that, and that's why I'm here.
And how long have you been practicing for now?
So currently I've been practicing for 5 years.
Yeah.
And right as I moved over to BC, this was my first clinic.
Oh, nice. Awesome. So I guess a little bit about me. If you guys are already on my channel, you guys kind of know who I am or what I do. But if you haven't and you're new here, I'm Cameron. I'm a physical therapist. I have a DPT in physical therapies. Did my studies in Australia, Melbourne. I did my 3-year doctorate program out there. So 2016 is when I started working. So that's 7 years now, just about 7 years.
That's quite a bit, yeah.
Yeah, I'm old. I look younger than I actually am.
No, he definitely looks older than he actually is. You should see the wrinkles on him.
Oh my god. Okay, we're going to put some filters on this one. Alright, so again, scope of practice. A lot of things that we do in similarly here, especially with Strength Through Motion. There are going to be a lot of common misconceptions between the practices, and especially for the general public who, again, don't know too much about what physios do or what chiros do. And again, traditionally speaking, I guess people tend to think of chiros as people who crack the bones, realign the joints, put things that are out of place back into place, and just kind of repositioning your joints and your bones. And again, people generally think traditionally that physiotherapists just use machines. So a lot of people come in and say, oh, what do physios do? Do they just put the machines on me, like the TENS machines, and then put some heat packs on me and then give me a stretch or two and take off? So again, that's the traditional way of thinking. But in terms of your experience here, Mike, what would you say would be some misconceptions that people think about chiropractic practice?
Well, I think one of the biggest things is we are not actually moving any bones, nor are we affecting your internal organs with any type of joint manipulation. In the name itself, it is a joint manipulation. That cracking sound that you normally hear, we're not moving bones back into place. That's what we call a cavitation, or just a release of a air bubble or a gas bubble.
Right.
Similar to opening up a can of Coke. You release the pressure, you get a sound.
And this.
Yeah. But we do find that joint manipulation is actually very effective for helping people move a little bit better through their ranges of motion. Sometimes where they just feel a little bit, stuck.
Right. And is it bad to crack your back? Like, for example, cracking your knuckles. I get a lot of patients asking me, like, is it bad for me to crack my knuckles or my neck and stuff like that?
There is no research or evidence that states that it is a bad thing to manipulate on your own, unless, you throw in some external techniques or you force something that really doesn't want to move just to achieve that popping sound.
Right.
That I would not recommend.
Right. And I guess we can touch on this in a future video, but just to kind of briefly talk about it, like a lot of people say, oh, does it increase the likelihood of arthritis for cracking my back? And a lot of people are scared because of that. What would you say to that?
There's no proven research.
Yeah, so exactly. So crack your neck, crack your back, crack your fingers and your knuckles. It's all good. It's just gas bubbles being released from the joints.
You got it.
Yeah. And with physiotherapy, like I said, a lot of people think traditionally physios just use machines and they give you a couple of stretches, they throw some heat packs on you. Now, if this were, say, 10, 15, 20 years ago, then a lot of people would see that when you enter a physiotherapy practice. And on top of that, you'll see that the physios would be seeing multiple patients at one given time, and I've heard of even like 6 to 10 people at 1 hour. So that's like 5 to 10 minutes per session.
In and out.
In and out. So it's unfortunate that we see that, especially in the past. But nowadays we're seeing a lot more of that one-to-one model, a lot more kind of the soft tissue manipulations, exercise therapy, which is, again, what scientifically evidence-based practice is showing is most effective when it comes to any kind of rehabilitation. Yeah, so machines still occasionally used, but I'd say my machines are probably collecting dust over the last year. I might have used them once or twice in the past 6 months.
Hey.
All right, so Michael, tell us a little bit what chiropractors are able to do here in BC.
So our main focus is to diagnose and treat issues of the neuromusculoskeletal system. And on top of that, everybody knows what chiropractors do. They always think of, hey, you know what, these guys are going to crack me up. So that's what we call joint manipulation as well. So we also incorporate the use of modalities such as shockwave therapy, laser, IFC, and TENS, really depending on what the patient diagnosis requires. And also some prescribed exercises depending on what we can do to achieve our patient's goals and expectations.
Right.
And furthermore, we are able to refer patients out for x-rays for diagnostic procedures as well.
Nice. Awesome. Okay. And how long will your sessions generally be when it comes to your assessments and your treatments?
So normally my initial assessment is 40 minutes long. That's where we take a thorough history, do a physical examination, go through a report of findings, and then do a treatment on the same day. And my follow-up or subsequent visits, normally about 20 to 30 minutes, depending on what is needed.
And do you find yourself, like, because you're mentioning you tend to, or chiros can refer out to x-rays and ultrasounds, diagnostic procedures. Do you do that often, or how often would you say you do that?
So depending on the patient, normally I would actually write a note and send that with the patient off to their general physician or general practitioner so that they can go through the system for that. And it's also nice to have a second opinion on before we send patients off for x-rays, so there's no need for unnecessary radiation.
Right. So you wouldn't do that for every patient. It would just be when you feel like it's indicated.
No, just as needed. If someone comes in looking with a weird ankle sprain that doesn't just seem right, then we'll send them out to the doctor. Hopefully there's no fracture.
Yeah.
But that's usually generally the way it goes.
Cool. Nice. All right. And so for physiotherapy or physical therapists, as we are known in other parts of the world, very similar to what Mike was saying. So we are able to diagnose issues. So again, we do a lot of musculoskeletal issues, neurological issues, and cardiorespiratory issues. But in the private clinic, we generally see musculoskeletal patients. So we can diagnose, we can assess, and we can treat these things. And again, we can use similar modalities to what Michael would be using in terms of shockwave, ultrasound, interferential machines, in terms of treatment styles. So again, for my personal preference, I like to do a lot of hands-on therapy. So when I did my training, a lot of kind of like hands-on, say, muscle, soft tissue release, a lot of massage techniques, which I learned from some of my colleagues here at Strength Through Motion, some joint mobilizations. And again, I can't do any kind of like high velocity thrust, which is like the manipulations to the joints, which again, I would refer to Dr. Mike here. And physios in British Columbia can actually do dry needling. So if you follow my channel, you know I love dry needling. If you haven't seen it yet, check out some of these links up there. I'm going to be posting some of the videos. But it's a very effective therapy that I love to use, and I use quite extensively in my practice. So I say a lot of my patients receive either a combination of hands-on therapy, dry needling, and the majority of the times I'll give them some corrective exercises as well. And all practitioners practice a bit different. When it comes to exercise prescription, I tend to give just a few because I don't want to overwhelm people generally.
Speaking of functional dry needling, funny enough, in Ontario, I would have been able to do that form of therapy. However, in BC, it's just not part of our scope of practice.
Yeah, so and again, that talks to us about the differences in terms of like even interprovincially, the regulations will be different. So definitely, if you are looking for a specific type of therapy, so say dry needling or manipulations or whatnot, check where you're from, check what the different practices are able to do. If you are specifically looking for, say, dry needling, then you might have to find a physical therapist in your area to do it, rather than, say, as Mike was saying, here in Ontario, even chiropractors can do it. So I guess for you, the mountains drove you more so than the needling itself. Yeah, okay. Yeah, that's awesome. Nice. Manipulation, some physical therapists can do that as well. However, you need to be taking continuing education courses for that. I haven't done that, so it's not something that I would do, and that's why I love referring my patients to Mike here. If I feel like a patient needs something adjusted or something that might need a little bit of loosening up, I tend to send them over to Mike. But again, the two of us, we practice quite similarly, and that's why we're great friends, right?
Yep.
There you go. Wow, leaves me hanging. All right, Mike, so now that we know what chiros and physios do and what some common misconceptions about chiros and physios, who should be coming to see you? Or what kind of patients do you generally see at the clinic?
So my general patient or caseload is just a wide variety. I'm very open to people from all age groups and all walks of life. So if you ever feel like you need an assessment for something that just doesn't feel quite right, I'd be more than happy to take a look.
Nice. So I guess here at the clinic anyways, you see a lot of, say, people from car accidents, sport injuries and stuff like that as well.
Yeah, that's pretty correct. And just the regular working professional or just anybody who just feels like they need a little bit something else.
Yeah,
or
some TLC.
Something more, yes.
Some TLC. And Mike's great at that. He might look a little bit stone-faced right now, but he's actually a really nice guy. So come check him out. But yeah, so same with me in physio. I love this. We see a lot of different types of injuries. Typically, we see a lot of ICBC patients here in Vancouver or in BC. ICBC is just the car accident patients who get into injuries from car accidents. We tend to see people from WorkSafe injuries as well. Maybe not at this clinic at the moment. And here, especially at Strength and Motion, because we're inside a gym setting, we see a lot of the younger athletic population. So people between 20 to 40, 20 to 50 years old.
Yeah, I would say that, yeah.
Like highly in tune with their body. They work out quite a bit. They play a lot of sports, so they generally have like an injury because of their sport or their activity, and they'll come check us out usually.
Yeah, even weekend warriors need a little bit of TLC every so often.
So as a busy working professional, I understand where you're coming from. The neck pain, the neck stiffness, the shoulder tightness, the headaches, the back aches. So a lot of people who are working from home now, especially after COVID, they're sitting in front of the computers a lot more, even more so than when they were at the office.
Absolutely.
They don't have that expectation to get up and talk to their coworkers anymore, so they can work 8 hours, 10 hours straight through the day.
Yeah, sometimes even going after too.
Yeah, it's crazy. It's hard to separate that work life. So I get you, like you're working at home and your neck is tight, your shoulder is tight. And so that's who we see a lot of here. And if you guys are interested, just some fun facts about physio. So again, a lot of people think that physios only work with musculoskeletal conditions, and rightfully so, because you probably only see physios in clinic in your private setting. But a lot of people don't know that actually physios train in cardiorespiratory therapy as well as neurological therapy. So we do kind of basic training in helping with asthma, COPD, people with post-heart surgery for exercise therapy, post-stroke, traumatic brain injuries, spinal cord injuries. So physiotherapy is a profession that treats a large number of things. But again, for our purposes at Strength and Motion anyways, and I guess for the majority of people in private clinics, we'll be treating mostly musculoskeletal injuries. Alright, so as you can see, there are some differences between our two professions, chiropractors and physios. But with that said, there is a lot of commonality. As throughout the video, you can see that a lot of the stuff we do is very similar. Maybe the major difference, especially here in BC, is that physios can do dry needling, chiros generally do manipulations, and other than that, like a lot of that's converging, which is nice to see. And that's it. And like I said, it's nice to see because a lot of our practices are based on evidence-based practice, and as the evidence becomes more clear, that our practice should be converging because that's what best care for the patient is.
Absolutely.
Right?
Absolutely.
So again, the traditional thinking of chiros only see neurological conditions associated with the spine and the back, and physios are more, say, muscles and joints, or muscles
extremities
and stuff like that. That's kind of, you can throw that out the window. So if you have any kind of discomfort, you can see chiro or physio. So to answer your question, it's more important that you find the right practitioner. So it doesn't have to be whether it's, do I see a chiro or do I see a physio? It's more about, okay, is that practitioner right for me? And again, everybody practices a bit different. But that said, guys, not all chiros and physios are made the same, right?
Yeah.
So it's really important that you guys find someone who is willing to put your best interests first.
If you're going to a chiro or a physio for the first time, don't be afraid to ask questions. Ask as many questions as you can.
Absolutely.
Because at the end of the day, it is your body, and you want to know about what's going on.
And hopefully this dispels any doubt about what chiros and physios do, and that we can actually be friends, because I know a lot of clinics either have only chiros or only physios. And here at SCM we have both of us. So don't forget to hit that like button, subscribe to this channel, and again, if you want any specific questions answered about the differences between physios or chiros, I might be doing one in the future with massage therapists as well. And if you have any questions specifically about what each of us do or anything else that you might be wondering about, please feel free to leave a comment below and I'll try to answer them when I can. But anyways, I'll catch you guys in the next video, and thanks again for watching. Peace.